Hi, my name is Bobette Haig. I'm currently 61 years old. My Lyme journey began in 2015. However, I don't know when I ever got bit by a Lyme, a tick. But my symptoms began in 2015, and they started with migrating joint pain that were very mild to start. I thought I might be dealing with maybe rheumatoid arthritis, and the doctor I was working with at the time didn't think it was, but agreed to do a rheumatoid arthritis test and food testing to see if I was sensitive to any foods that were causing these joint pains. And we went back and forth maybe for about 9 months with just trying to figure out what was going on with my joints. It could be my feet, my hands, my knees, shoulders, it didn't matter, elbows. I could wake up one morning and I couldn't walk because both my feet were inflamed and with joint pain. And after about 9 months working with my other doctor, he said, I need to talk to somebody who might know something else, something more. So that's enters Dr. Murphy. And I was introduced to him in the summer of 2016, and he did an extensive interview with me. He ran some blood work. He suggested to me before the blood work was done that it might be Lyme, and I remember thinking, I don't have Lyme disease. I've never gotten bit by a tick, but I'll do the test anyway. I want to get to the bottom of this. I want to find out why I can't walk, why I can't. I'm having a difficult time driving a car because I couldn't actually grab the steering wheel. My hands wouldn't close. My joints were getting so inflamed and painful, extremely painful. And so anyway, we went forward with the blood work, and lo and behold, my Lyme test came back positive. And that began the journey of healing. I started Dr. Murphy's protocol in September of 2016. He told me that it would take time. He said 3 to 9 months I would start noticing some changes. It might get worse before it gets better. But he walked me through every step of the healing process. And I was coming to Dr. Murphy barely able to walk. I was almost in a wheelchair. I wanted to use a cane to get around. I mean, my symptoms were, I was deteriorating rapidly. My muscles started to atrophy. I didn't have the strength to get out of a chair. But the program that Dr. Murphy started me on in the fall of 2016, again, began my healing process. It was very gradual. It seemed slow at the time, but I look back on it now and I'm grateful for every step that we went through. I was doing saunas, I was doing True Rife, I was doing, he had me on a mild exercise program so that I would be able to get out of chairs and would be able to walk, and he had me on some supplements. I also had to do lasering for my joints, which I noticed that helped almost immediately. And again, step by step, I would say by about 4 months into it, there were very subtle changes that I would wake up feeling, I thought, oh my gosh, I feel like I can move today. And then I wouldn't say anything to anybody. I thought, no, this is too good to be true. This is just too good to be true. I'm moving. And then maybe another 2 weeks, I'd be doing something else. And then my family was starting to notice there were changes. I had more energy. I was able to get in and out of a car easier. It sounds like simple everyday things, but when you take those simple everyday things that you do all the time and you can't do them, you realize just getting through the day, all these little steps along the way, how much you start to appreciate those subtle changes. And just day by day, and I would say at about 9 months into the program, I would say I was at least 60 to 70% better. I was able to travel easier. I had family that lived out of town. We went every month to travel. Traveling's very difficult when you can't move. And at about the 9 month point, I was able to travel easier. Again, feeling feeling so much. It was incredible, the difference in that 9 months. And then every month after that, better and better and better. And now it's 2021, but I've been, I'd say, healthy and 98% better since 2000, probably 2018, middle of 2018. I've got my life back, and I have Dr. Murphy and the protocols that he put in place for me to follow to thank for that. And I'm so appreciative.